we go. Okay, so we want to continue with the communication and sensory. This is part two, or three, excuse me, and we want to discuss hearing loss. I also want to talk a little bit about my own hearing loss and the cochlear implant as we go through this process. I'm sure you've seen individuals who've had hearing aids, some that may have cochlear implants. The cochlear implants can be obvious, a little more obvious, as they are in this case, or they can be a little less obvious, where they might just have a circle or oval type disc that sits here, or if they have longer hair, you might not see it at all. But let's start with the hearing loss in general and get to, let's see if I can get into this a little quicker. So, hearing loss, when we take a look at hearing loss, and you have this image on your PowerPoint handout, basically there are a lot of different reasons why someone might lose their hearing. One of those is just the process of aging and getting older, and just like everything else that we have talked about in every other body system, we can have a loss of both. The hair cells in the cochlea can get broken and diminished and not work as well, or we can have the auditory nerve that doesn't work as well, or we could have something over here that might not work as well. So when you think about what is going on inside the ear and why the person has a hearing loss, what you first need to take a look at and consider is where was their hearing impacted? Is it impacted from the external cannula, the middle ear where the bones, the malleus, incus, and stapes are located, the inner ear, which is the cochlea, the auditory nerve, or the brain? And we could have a problem with any of those, or a combination, which would give us a combination type of a hearing loss. If it is a conductive hearing loss, it is a hearing loss that's impacted before the inner ear. So from the outside external ear to and through the middle ear, so including those ossicles. Somewhere in there, if the sound cannot get through, then that's going to be called a conductive hearing loss. If we're dealing with the cochlea or the nerve and brain, we're going to call it a sensory neural hearing loss. And then if it includes both, it's going to be mixed. Then we also, when we think about hearing loss, it's interesting that hearing loss is often referred to as, first of all, invisible, because you can't really tell that someone has a hearing loss unless you pay attention and notice a device. And it also can be discussed in terms of some numbers, and that's what this audiogram basically does, and we'll look at another image of an audiogram in a minute. So if you take a look at this audiogram, these first couple of rows, that's normal hearing. The blue here is the left ear, and the red is the right ear. Now the blue ear is, this is just the arrows are just showing that the tympanic, where the tympanic membrane is functioning. The other lines are showing where the hearing loss is at. This yellow banana shaped area is actually called the speech banana, because it does kind of look like a banana, but that's where all the main speech sounds are. And when someone has a hearing loss due to aging, they start losing, like this here, red line first, and they lose all these high frequency sounds first. If they have a hearing loss that's conductive, they look more like this left ear does with the blue line. So this person has a sensory neural hearing loss with the right ear and a conductive hearing loss in the left. For the sensory neural hearing loss, or the hearing loss that's due to older age, which is also called presbycusis, they lose these first sounds first. So T, F, H, K, and then G, C, H, S, H. So over here what we're looking at is the difference between sounds like mash, map, anything that sounds similar. So if you're talking about, let's say, math, and I can't say fath, that is not a word. But if you have two consonants and the sound of the word is basically the same except the first consonant, then that person can no longer tell which sound you're saying. So they can't hear those sounds anymore. And so they can get confused. Not that they're confused, but because they can't tell exactly which word you said, that's when they start doing this what. And can you repeat that? They also, if they have hearing loss due to older age, they can't process as many things as once. So if they're reading or paying attention to something else, or if it's really loud, they're going to have more trouble hearing those sounds. As this red line goes down, you can see if we pulled it down, you would start losing these other sounds. And these sounds are a little easier, like map and mash. They sound different, but they can be easily confused in these cases. And then as you pull this all the way down, you're going to lose all the speech sounds eventually. These are just some definitions on the differences between middle ear damage, inner ear damage, and what that might look like. My animations are gone, so we'll just play this kind of old school. Conductive, remember that's this flatter line. That's as when the outer ear is having trouble channeling sounds to the middle ear, and sound isn't getting pushed into that cochlea well. And we can also have some other things that happen as we get older, like the cerumen glands atrophy, so that's the wax in your ears. The cerumen becomes more dry, and our older adults often, as a result, have impaction of cerumen that can cause a conductive hearing loss because the sound can't get through. So this is a common test question. You have drier cerumen, and you do make more, even though the glands atrophy. But because it's drier, it can't move out of the ear canal like it normally does, and it becomes impacted inside the ear canal. I like this image because although it's pretty much the same as the image we looked at a second ago, it also includes some other sounds that belong on the audiogram. So they've put the speech sounds in here and just written them in, but they've also put birds, dogs barking, kids crying, some other things that you might hear in the environment. And so this person who's both right and left ears are down here is only getting this one letter, which is, I believe, the letter E. That's the only sound that they can hear and understand. All the rest of these sounds are gone, and they certainly aren't hearing the birds, which is clear up here. Our older adult with that red sloping hearing loss is lost again. F, T, H, S, maybe the K, definitely the birds. And so it's interesting to see those differences as well. See if I can shrink this again. No, it doesn't want to do it. So let's take a look at our healthy ears and how to promote healthy ears. One thing, first of all, that happens with older adults with hearing loss is that they don't, if it's just caused by slowly deteriorating hearing because we're older, they don't notice that their hearing is diminishing. They don't realize that it's diminishing, and they just assume that there's a problem someplace else because it's so slow and progressive that it's not obvious. And so it can be hard for them to realize they have a hearing loss. Many times, hearing loss is stigmatized, and people feel like they are old if they're wearing hearing aids, even if they're 90. Um, and so there's some adjustment and a grieving process people go through, just like with anything else. Like if you were diagnosed with cancer, there would be a grieving process that you would go through. One of the most simple things that you can do to help someone who has a hearing loss, besides some good communication techniques, which we will talk about in a minute, is purchasing hearing aids. So hearing aids are small electronic devices. They amplify sound, and they're programmable unless you get a generic amplifier, which means that I can adjust the sound to get it in that speech banana so I can help you hear the very best. They help improve speech comprehension, but unfortunately, people have to pay for these outright. So they have to have the money for them. Insurance doesn't cover. The VA, the Veterans Administration, will cover if the person can demonstrate that their service to the military is what caused their hearing loss. And if they went through basic training, then pretty much that's true in the case. Now, what big question I ask when you guys are face to face with me is, so not a big deal, right? They got to pay for them. So how much do hearing aids cost? Well, I can tell you that one hearing aid is going to cost between $2,000 and $4,000. Two hearing aids, $5,000 to $6,000. You need to replace them every 5 years as your hearing gets worse, and the hearing aid either can't keep up with your hearing loss or the hearing aid doesn't last. Typically, they last about 5 years. So there's, let's say, $6,000, because if you've lost your hearing in both ears or bilaterally, then you're going to need two. $6,000 every 5 years. Plus, you're going to need ear molds, batteries, and other things that are going to be an ongoing expense. You may need to visit your audiologist more than one time a year in order to have things adjusted and to keep them working well. So hearing aids are expensive. A good question that a lot of students ask is, so why are they expensive? Basically, right now, Medicare, which is the driving force in how medical bills are covered and paid for, Medicare doesn't cover hearing aids because they're considered non-life saving devices like a walker, crutches, a wheelchair, and none of those things are covered. That doesn't mean that it's right, because people can really have a lot of problems if they don't get their hearing checked, and we'll talk about that in a little bit. The other thing you can do is to really, truly, honestly avoid exposure to loud noises. This means you're riding a motorcycle, you're mowing your lawn, you are using the vacuum cleaner, wear earplugs and hearing protection. When you go to the football games, it's not quite as bad, but definitely when you go to the basketball games, it is horrendously loud. And anytime you attend a musical concert or something like that, if your ears have ever rung after you've done any of those things, it was too loud. That's a sure sign that you've experienced some damage to your hearing. You can still enjoy the game with hearing protection on. You can still hear the person next to you if you have earplugs in. And they really do a lot to help protect your hearing, because once it's gone, it's gone. Also, avoid injury to your tympanic membrane. So don't clean your ear canals with Q-tips or other cleaning materials. Use assistive devices like hearing aids or other amplifiers. And if you ever have a sudden change in hearing, especially if it goes away to any degree, you want to get in and see a ENT professional and start treatment within 24 hours. This is essential. So my son, we have a ton of hearing loss in the family, but my son woke up one morning and said he couldn't hear anything out of one ear. Thankfully, I know a couple of ENT docs, and we got him in and started him on high dose prednisone, and it came back. The doctor believed it was due to a virus, and the only reason my son told me about it is probably because hearing loss is such a big deal in my house. Otherwise, he may not even have noticed or mentioned it. So pay attention to those things, and if your hearing's gone, you really seriously have to get in very quickly. And if you ever hear of anybody else, let them know that as well. Okay, let's see if I've covered everything here now, because I've messed up myself on my slides. There they are. No wonder I didn't know. They were hiding. So here's another good example. When you take a look at this kind of visual, it shows you the sounds as we get to the middle part of your cochlea, which is what we're showing in the center here. This is the cochlea. You're looking at things that are like the Grand Canyon at night, a bedroom at night, 25 decibels. Okay, and then as you go out, you're getting louder and louder. So here's a rifle at 138 decibels. That's basically where the stadium is in a basketball game for the entire hour and a half that the basketball game is going on. Rocket launch, 180 decibels. The airbag going off. Can you believe it? Weird. So these things all impact your hearing. If your ears ring, it's called tinnitus, and about 50% of people will experience tinnitus at some point in their life. People who have a hearing loss often experience tinnitus at all times. And 1 in 5 U.S. teens are now experiencing hearing loss because of headphones and earbuds use. So earmuffs, if you're going to use some earmuffs to protect your hearing, $3. Yes, you could spend $600 on a pair of earmuffs, but you probably don't need that type of an extensive pair. You could also get some for 50 cents. So it's not something that you have to spend a whole lot of money on, and they'll be pretty good. If you're going to use them all the time, you might want custom ear molds or earplugs. If you're a musician, for example, you might want custom ones so that you can hear better. This image over here in the bluish colors is an image of the inner hair cells inside the cochlea, and when they get damaged, they actually look like they've been broken off, bent and broken off, and they don't regrow. And exposure to super loud noises can make them break off, or just that lifetime exposure to life can cause that. So I wanted to talk just a little bit about my cochlear implant so that you could get that experience, because you might not get that experience in any other way. So the cochlear implant is actually a device that is surgically implanted under the skin and through the skull and into the cochlea. So there's a device under the skin here. It's always there. It's a receiver. There's a wire that goes through this way, through that bone behind your ear, and it's threaded into the cochlea and then run around that little snail shell. And it delivers electronic signals to the auditory nerve and to the brain, when then your brain interprets those signals into sound. Person with a cochlear implant wears 2 pieces on the outside, one behind the ear that looks a lot like a hearing aid, and a transmitter that is connected by a magnet to this device under the skin. You have to be extremely profoundly hard of hearing before they'll do a cochlear implant. And you need to understand less than 20% of speech spoken in the sound booth in quiet conditions before you can be eligible, because once they put that electrode into your cochlea, all those hair cells are going to get broken. And so they're going to permanently damage your hearing, and they don't want to take something away that you have. So for my case and my hearing loss, basically, when I was 17, I was diagnosed with a hearing loss. I was playing softball and actually playing third base. My coach said that I wasn't hearing him from third base if something else was going on. So like the speakers, they were making an announcement, that type of thing, and I wasn't hearing at that time. I cannot make this go away for the life of me. So I'm going to try to pull up the audiogram here in a different way. There's presbycusis spelled if you wanted to know. Presbycusis. All right, so when I was 17, I was diagnosed with a hearing loss. Look, something like this, a high tone hearing loss. It was almost exactly the same on both ears. Basically what the doctor said at that time was you have the normal hearing of your average 65-year-old. I have a ton of hearing loss in the family. My dad, my uncle, my grandparents on both sides, and then a smattering through all the uncles and cousins on that side. So we weren't surprised. We had kind of anticipated that any of the kids might have a hearing loss. And I had been tested as a child, and I was told it was fine, but I was a kid. It may not have been super accurate. And then my hearing loss just has progressively gotten worse over time. So when I went to get my cochlear implant, my hearing loss had progressed to something that looked more like this. I had some up here. Actually, this was a little bit higher here, around the 0.5 range. It was about 50 to 60, and usually that means you can hear about 50 to 60% of the words. However, in my case, my speech understanding also dropped, and I had nothing in these high tones. With my hearing aids in, I was doing better, but I still was struggling in a lot of environments, and it wasn't working well. My hearing aids weren't working well for me. So we went ahead with a hybrid cochlear implant so that we could keep these ranges from 1 to 0.125. It means that the electrode only gets put in to about here, so that those hair cells in this area aren't damaged, and you can still use this part. So it's a shorter electrode, basically. And when they turned it on, I have an example of a video of what it sounds like when a cochlear implant is first turned on. It does sound pretty mechanical, but I was able to understand speech at like 70%, from 18% to 70% right away. And that's not the case for everybody. A lot of times people will struggle, and it'll take months before they can relearn and train their brain to hear again. But in my case, I was really lucky, and I was hearing well again right away. And I did eventually, in about 3 months, have something go on, a viral infection, and I lost all of these low tones. So now if I take my cochlear implant off in the left ear, I have nothing. Nothing registers. Absolutely nothing. In my right ear, it still looks like this, and my hearing aid is in my right ear. And so I can hear some things if you were loud enough, and on my right side without any aids in. And I read lips extremely well, so that helps. So there's a lot of things that we can see that can be helpful. The context of this situation, the amount of noise in the background makes it harder or easier for me to hear. And like I told you on the first day of class, if you're behind me and you say my name, I'm probably not going to hear it. And certainly I'm not ignoring anyone. But the key things we'll talk about here in a second are how to get a hold of a person's attention so that they can hear well and understand what you're saying. Okay, so we talked about the cochlear implant. It's really exciting. I love the fact that I was able to get a cochlear implant, and I would do it again in a heartbeat. Going back to older adults, and older adults can get a cochlear implant, it's just fine, especially if they're pretty active and they're willing to work at rehab to get it better, then they'll do well. My grandma had a cochlear implant when she was 65, and she called me on the phone. I didn't recognize her voice because she could hear herself, and so the pitch and tone of her voice changed. But she was like a kindergartner. She's like, I went to church today, and guess what? I heard everything. She was so excited and thrilled. And my uncle, who is 65-ish now, just got a cochlear implant last year, a year after I got mine. He should have had one a long time before I had mine, but that's okay. So for older adults, I would love to give you a ton of examples of hearing aids and show you how to put every single one in, but the fact of the matter is that you're not going to remember that because there are a ton of different types of hearing aids. They all look different and they all get inserted differently. What I would really encourage you to do is every time you have a patient who has a hearing aid, ask them, can you show me your hearing aid? Can you show me how the battery goes in? And can you show me how you put it in your ear or take it out so that I can learn about the type of hearing aid that you have? Usually you're going to have 5 minutes where you're going to be able to do that, and they'll probably be happy to show you. The other thing I want to talk about is long-term care actually has some areas that could use a lot of improvement. So you've heard of the American with Disability Act. It basically says that employers and venues like theaters and hospitals and all types, churches, have a responsibility to make sure that we accommodate for people who do have a hearing loss. So in churches or a theater now, you can go in and you can get a amplifier where you can turn the volume of the movie or sound up or down where you like it. You can get a closed caption device at the local theaters now. Hollywood Theater has glasses, and you wear a little thing around your neck and you put the glasses on over your own, and little green words show up at the bottom of the glasses, and you can read the text as you go along. And the Forum Theater has a device that sits in your cup holder, and it's just a black box, and again green words, because I don't think it bothers other people, show up on that device so they can follow what's going on as well. And I use the captioning device every time I go to the theater now. I probably would never have done that except that I, at some point, a movie came on when my kids were younger, like a Disney movie, and the captioning automatically came on, or one of the kids hit the right button and the captioning was on, and I I looked up and I read at some point something that was funny, and I read the words off the screen, and I'm like, oh, I didn't realize I missed the joke there. You don't know how much you miss, and so the captioning can really help with that as well. In long-term care, we have a little bit of a loophole. So the ADA, basically the ADA law states that assembly areas with fixed seating where audible communications are important to the event must have a permanently installed assistive listening system if they accommodate at least 50 persons, or if they have an audio amplification system. So if they use a microphone, they need to have some type of a system. The minimum number of receivers to be provided should be equal to 4% of the total number of seats, but never less than 2. So if you can get 10 people in, then you need to have 2 at a minimum. 4 would be preferred. But did you read what it said in there? It says fixed seats for 50 persons. They are fixed, so that means that long-term care falls through a little bit of a loop there. Their seating isn't fixed. We move it around so we can clean or do different activities. So most long-term care facilities do not have additional amplification systems. They're called FM receivers. We do have one at Tiger Place. It's basically a set of 12 is how many we have. We have a lot of people with hearing impairment, and then one person will have the microphone, and it goes to each of their ears, and they can turn it up and down. I did one presentation in the theater at Tiger Place, and the theater's a really nice room because it's soundproofed, and so it's a good room to go listen in. It's a good room for everyone to listen in. And one of our residents came in. She came in a little late. We're using this system, and the social worker helped her with getting hers on. And I was already started to talk, and so I was continuing my presentation. And when she got her system turned on, she's like, "Oh, I can hear," really loud in the middle of the presentation. But it was great because she actually could hear, and who knows, she's been going to all of these presentations and she couldn't hear anything, and that's really unfortunate. I've also seen was told about another individual where they brought these devices to a long-term care setting, and they were doing some other type of activity, and they brought the FM receivers in, and there was a lady who never really lifted her head from her chest, never participated or interacted with anyone, and she hadn't spoken in years. And so someone helped and put that on her and adjusted what they thought would be appropriate. And when she heard what was going on, she lifted up her head and started participating. She just couldn't hear. And if you can't hear, how are you supposed to be actively engaged? And we don't notice it. Nobody knew that was the problem. So I think it's important that we work with long-term care facilities to help them upgrade their systems. Make sure that we get regular visits by the audiologist to long-term care facilities. Clean devices, clean ear canals. Nurses can clean ear canals. We just do irrigation. You do want to make sure, however, that the solution you use, and you can just use tap water, is warm, like tepid, the way baby formula feels on your wrist before you give it to them. Because if you use too cold of water, you can cause problems with the neurological system, or get puked on really quickly. And then also, long-term care facilities need some specific guidelines for individuals who can't handle their hearing aids on their own. They need cleaned every day, just wiped off. They need their batteries replaced at least once a week. Some of the batteries will last 3 days, some of them last 5, some of them will last 7 to 14 days. So it's important to check the charge on the batteries. There's no sense in putting them in upside down, backwards, and without batteries. We also need to work on methods to prevent loss. It's hard to put your name on a teeny tiny device, and it's also hard to connect teeny tiny devices to your clothing. But if it's possible, and if they are using behind the ear hearing aids, it's usually a little more possible. Those are very great ways to help keep track of them. And when they get thrown away, they cost a lot to the facility because the facility has to replace them. There's some other resources on your slide, movies and other resources you might find helpful, and some financial assistance information on the hearingloss.org site. If you have any questions, sure don't hesitate to let me know, okay?